My name is Andrea Aldana. I'm a PhD psychologist, and I develop an intervention that massage therapy in skin-to-skin contact. So basically, when you start doing the massage therapy in skin-to-skin contact, you have to do it 1 hour after feeding, when the baby is calm and like kind of had the disposition to start doing this kind of intervention, and the mom have to be secure. So when I know that the mom is secure, when she's already doing the skin-to-skin contact. So after a couple of days, when she knows the practice and the skin-to-skin and know how to hold the baby, basically you start doing the massage therapy in skin-to-skin contact. And it's just 2 phases. The first part of the massage is basically you start always with the head, that is the less invasive part of the body. So you start from your head and you go to the back, and have to be a really gently movement from 1,000 to 10,000, and then you go back. And for the arms,
what do you mean 1,000 to 10,000?
1,000 to 10,000 is because we have to make sure that the baby
1,000 what?
1,000. You say the word 1,000, and that
Oh.
make 1 second. So because we can give a mother a watch, so she has to say 1,000, and when she say 1,000, that make a second. So basically, she start counting from here when the baby's in the skin. So 1,000, 2,000, 3,000, until she reach the hand, and she say it's 10,000. So that's what I'm saying, that, and then she backs again, counting from 1,000 to 10,000. Have to read really gently, and you have to look at the stress signals. So when we say stress signals, we talk about changing the color of the skin or the saturation of the baby. She's going low, but most of the time it doesn't occur. It's more like a communication between mom and the baby, so it's really gently. And I always say that the mother is the best doctor in identify what is good for the baby and is not in terms of physical contact. So she's really like aware of that, and she's just keep doing this in one arm and then start with the other one. And it's the same procedure for legs. Once you finish legs and arms, you stop and you start doing the back. So you just use all your palm or your hand doing from back like this. So you just start doing this movement until the end, and you just finish. And then you back from here, and you start from here, and then you, and it's gently and counting from 1,000 to 10,000 always. So 1,000, 2,000, 3,000. It's that kind of movement that we have to practice. And then when you finish the massage, you can like just talk to your baby and say like, how is everything going? You are doing well, and this encourages the mom to feel more confident when the baby is discharged from hospital. The good thing about the massage is that the mother develop like a daily routine of care with the baby, separate from the skin-to-skin contact. Like she has like a meeting with the baby. Like, okay, I'm going to give you this kind of care and express you all the love that I have for you. And it's based on the evidence that this kind of massage improves growth development. So you are doing both things at the same way. So that's basically is the massage.
What contraindications are for babies? Like the size of the baby, condition of the baby?
Yeah, so the idea is always do it with stable babies, less than 32, with 32 weeks or 32 weeks. And we always ask the neonatologist if we can start doing the massage therapy. Of course, we show them the procedure before about the massage, and he always disagree with do it because he see how the response in terms of gain weight. So that's why we are. So I mean, we work together with all the professional health that work in the NICU, because they say like, okay, they are coming to do a skin-to-skin contact, but we need to give them something more to practice that improve growth in babies, so that we implement the massage therapy in skin-to-skin.
What about the type of oil?
Yeah, the oil is so important. We always use sunflower oil because it doesn't cause reaction allergies in the skin of the baby, and involve the components of the oil. If we look at all the kind of industrialized oils, like really well known around the world, the base of those oils are in petrol. So that, as you know, the skin of the babies can absorb the nutrients of that
mineral oil.
So we always suggest all the oils that are natural. So almond oils or sunflower oils or coconut oil. But there is a studies that already show that the most effective one is the sunflower oil. So that's why we are using sunflower oil. Yeah.
How you mentioned that is done for the extremities and the back. What about the head or the front?
Yeah, that's our thing that I forgot. Sorry about that. We start with legs and then we go to the back, and then we finish with the head. from here to here. So actually I hold with this hand my baby because it's in skin, and with this one I will start gently doing from here with my onto the back, and from the back onto the front, counting the 1,000 until 10,000. So it's like 1,000 to 2,000, 3,000, 4,000, back and then forward.
And this is something that you also recommend the fathers do, right?
Yeah.
Anybody that is in kangaroo care?
Anybody that is in kangaroo mother care and practices skin to skin, no, the nose.
So nothing in the front, like you don't turn him over and start just in the back.
No, because it's already measured that it's really stressful for the baby. So we already have the transfer from the incubator to the skin to skin that is already stressful sometimes for the baby and the mom that have to do it. So we just decide to keep in this position something that to add on, and it's basically the same procedure that Tiffany Phil used for the incubator. So we are just doing the same protocol, having the same outcomes that she found, but in a skin-to-skin contact. And we don't have to turn the baby because there is no need to do it in order to have these growth outcomes.
Is there a benefit of having like music?
It depends on the NICU because I always recommend that the voice of the mom and the father is the best way to
So like she should sing or
if
talk
she wanna
or
sing. Of course we are talking about really like not louder
like
and
whispering.
music. Yeah, like something, or just like words like I love you. I'm doing this because you are part of me. You will
Like
be
being a
fine.
cheerleader.
It's not. Yeah, it's just like encouraging, giving the baby like the way to just scale up.
How often should a baby to have the massage therapy?
I always say until 12, until corrected age. So when the mothers learn the technique in the NICU, then they are discharged from hospital and they keep doing it at home.
Okay.
And then when they come to the ambulatory routine in the hospital, we always have these workshops about massage and skin-to-skin contact, and they ask and they share the experience like, okay, this was my first week doing massage therapy in skin-to-skin contact. This was my challenge. This was the thing that I realized that my baby is knowing from me as a mom. So a lot of mothers say like they recognize my voice. I can't communicate with him and I can't understand which part of the body he prefers or she prefers. So some of the moms say like I always repeat the back because they are so like in the mood of relax and just.
And it's not a hard touch, right? It's
No,
not pressure.
that's so important. I always say to mom to do the pressure in the hand of someone next to her. So for example, if she's with her husband, that from 1 to 10, we have to do a pressure of 5. So 10 really extreme, and then 1 really soft, and then you do like kind of 5 pressure on the hand of the person, and if the father feels that is pleasant, so he say like to the mom, yeah, that's the pressure that you have to do. So it's hard to say to measure the pressure that you have to do, but the best way to do it is always do it before in the arm of someone, and you replicate it. Of course, the sensitivity of the skin of the baby is different and is so exposed and is changing, of course. But it's the best way to measure the pressure, and you always see how the mother is doing it, and you always like try to teach her like the pressure and not too soft but not too rush. Yeah.
What about how often in the NICU? Like every 3 times a day, one
We
time a
say
day?
like it's kind of an antibiotic, so we say like very a good antibiotic, and the neonatologists are like no, and I say like it's a love antibiotic. So the mothers always arrive at the NICU, for example, in our unit in Bogota. The mother arrives around 8:30. She gives the first feed to the baby. She changed diapers and everything, and she put the baby in skin. So that's the first massage. 1 hour after feeding, then the mother have to go to have lunch. So she has to have lunch, leave the baby in the NICU at midday, then she back at 1, she feed the baby, she put the baby in his skin, and that's the second one. And at 6, 7, when she have to go to home, or when the father arrives to change the position because it's the night shift, So maybe sometimes it's the father that say, okay, I'm gonna change the diaper, I'm gonna put the baby in the skin, and because I'm staying tonight in the hospital doing the night shift in skin, I will do the massage. So 3 times per day, 15 minutes, 1 hour after feeding. That's the best.
So it lasts about 15 minutes?
Yeah. Of
No
course,
more than 15, right?
no, because that becomes really.
And it's okay to do like,
Yeah.
start with maybe 5 minutes or 3
I always
minutes.
say that the 15 minutes could be intermittent. Like you don't have to do straight away all the 15 minutes. You can do the first minute that is just arms, contain, weight, and then you start doing legs, weight, and then you can do back, weight, and then you do head, weight.
What are some things that you have seen moms can do wrong? What are some of the lessons learned?
For example, when it's the first baby and it's premature baby, for those moms are quite a challenge to give this kind of massage because this is her first time, so it's kind of complicated. So I think that for those moms that are just, I mean, it's the first time that they're a mom and it's the first preterm baby is really difficult for them, so they don't feel really confident about anything most of the time. So
Start with the arms one time.
yeah,
Or start with the back.
yeah, go really, really, really slowly. Yeah.
And if somebody has any questions, can they contact you?
Yeah, of course, they can contact me. My email is aldana17@gmail.com or
I'll have it there.
yeah.
Okay, thank you so much.
Now you're welcome.